From Nevada Public Radio, I'm Zachary Green filling in for Joe Schieneman. It's State of Nevada. Well, fall is officially here, and as the temperatures cool, it's safer to take your fur-covered pets outside in the neighborhood, the dog park, and even the hiking trail. But just because the weather is nicer, it's still no picnic for your pets. Hiking trails are laden with thorns from all those prickly plants that make our desert home. Then Halloween is coming up. And what happens if your dog consumes chocolate? Is it good for them? What about Thanksgiving in the next 2 months? When the kids start feeding the pups those hated green beans or that Jello-encased vegetable salad under the table, can that kind of human food hurt your animals? Shadi Arafij is the Chief Medical Officer at VetTriage.com, and also with us is Master Dog Trainer Gregory. Dr. Shadi and Master Dog Trainer Gregory, welcome back to State of Nevada.
It's good to be back. It sure is.
Indeed. Thank you so much for having me.
So we have a lot of questions from our staff members. We even had questions come in over email just over the weekend. And this first question I have is from a staff member, and her name is Allison, and she says, "Our cat Mowgli screams and howls all the time. It sounds like he's in pain, but nothing seems to be wrong. We notice he does it a lot when we aren't giving him attention or are in the other room where he's not with us. We think it's separation anxiety, but how do we know?" Dr. Shadi, pets can't communicate in English to us, but they can kind of tell us when something's wrong. So what are your thoughts on this?
It's tough in these scenarios because you want to differentiate behavioral, emotional, or psychological reasons, whatever you want to call it, to something actually wrong medically speaking with the pet. And some animals are easy to interpret. Dogs will tell you how they're feeling, and cats are less so. They're much more mysterious in how they act, especially when things are not 100% with them. So you want to differentiate between those two categories, something in their mind versus something affecting them with their body. So if you are trying to differentiate those things at home, then obviously in terms of the medical side, you want your veterinarian involved. But towards the emotional side, try to be more conscientious of their surroundings. Is it happening at the same time every day? Is there a new dog that was moved in next door? Are there fireworks every time it's happening? What's the consistency, the day-to-day patterns that you're noticing? Just be more conscientious of their surroundings and see if there's some sort of pattern you can recognize, and then go from there.
So is this a concern that maybe she should take her cat into the vet to get checked out if it continually happens, or the meowing gets louder or happens for longer amount of time?
That certainly is relative, right? It depends on how are you viewing that as a quality of life issue for your cat? Is it happening often enough, and often in quotation marks, to where you think this is really a concern? Or is it so random or rare that it's just one of those things, maybe my cat's just a bit odd? So you have to differentiate whether or not it's a quality of life issue, and is it worth going to the veterinarian for it? Obviously, as a veterinarian, I'm going to be a bit biased and say, sure, you should go to the veterinarian, have a physical exam done, get your basic diagnostics collected, make sure there's nothing more seriously wrong there before you back into the diagnosis of something behavioral.
Now I want to jump over to a question from Christina, who says, "I feel like retractable leashes should be illegal. It's easy for a dog to lunge at another dog or hurt someone. I also feel like all dogs should be leashed to a harness and not collars. Pulling on a dog's collar is horrible for their necks." So, Dr. Shadi, again, I wonder if you agree with Christina that pet owners should avoid traditional collars and retractable leashes.
It's hard to make a blanket statement like that will satisfy all situations, because there are certainly scenarios where you want your dog to have a body harness, and there are certain scenarios, especially with training goals, that you want to have a neck lead on them. So it really does depend on the scenario. It's hard to make a blanket statement like that. I've seen neck lead injuries that can be pretty severe, and not everybody can afford to have different types of leashes. And you also have to determine based on your own pet. What is your dog's personality like out there in public? Is it the kind of dog that stays pretty close to you, or are they tugging on the leash and trying to get every single pet and pet owner out there? So you have to make that determination for yourself. Basically, the premise is use common sense. See how your pet is interacting with the world and figure out what's considered socially acceptable amongst us humans, and then adjust appropriately.
And is it normally dogs that are creating the neck injuries for themselves, or is it the owners that are pulling too hard on the leashes?
The most common medical example that we see that creates a real potential life-threatening emergency is usually accidental. The dog is about to walk onto the road and there's a car coming, and so the pet owner obviously reflexively pulls hard on that leash, harder than you normally would, and now you have a problem there. Or if it's something malicious where someone's really trying to treat a dog badly, those are the most common times that we see really severe neck pull injuries. Otherwise, it's more of unsettling to see when you're trying to manage your dog this way by pulling hard on the leash. And if it's truly helping the dog in terms of some sort of long-term permanent training goal, great. But if it's starting to become more on the abusive side, then perhaps something needs to be reevaluated.
And Master Dog Trainer Gregory, I want to know your thoughts on this when it comes to having a collar on a dog versus having a harness on them.
Well, the challenge is that harnesses, collars, leashes, they're all tools. And one of the things that's happened is this idea that these tools are always inhumane unless they make the dog feel better and make the dog feel empowered. And, we use hammers, we use saws, et cetera, to build houses, to build shacks, to build a dog house. And they're not designed for that. They never were. But have they ever been used for damaging something or somebody? Of course they have. Hammers have been used to do everything from assault to murders. Same thing with saws, et cetera. So if we look at it and understand that these are tools, now I wouldn't recommend you go out and get a tool if you've never had any practice in using it. And so the biggest challenge is if you're going to get a tool, make sure that you get the education that goes with using that tool. Everything should come with some type of an instruction, but unfortunately people get these tools, they have no idea how to use them, and they can damage their dog. Now, for the whole thing with the retractable leads, those are at a point where, in fact, some, I think in Henderson, which is a nearby suburb of Las Vegas area, I think they're actually illegal when they go out past a certain level. So I think the laws there run somewhere around 6 feet. Your dog can only go out to at least 6 feet. So if you have a 20-foot retractable lead, then your dog's out of compliance at that point.
And what are some of the dangers with retractable leashes? Is it just once your dog gets so far away from you, you just can't reel them back in? I mean, I had golden retrievers, and we used to have the retractable leashes as well. And once they get to a certain point, you're just trying to, it's like fishing. You're trying to get your dog back to you and retracting it and stopping it.
Exactly. The biggest challenge is like you said, to get that momentum, they can fly out to the end of it. I've actually seen one snap apart as the dog hit the end of them, and then your dog's taking off. The other thing is that they're difficult to use for training a dog because the dog is in control of what's happening, not you. And so one of the biggest challenges that come with people in dog training is this idea that we have to accommodate the dog. Everything is about accommodating the dog. And those aren't healthy relationships, period. If those were human relationships, we wouldn't sit around and go, well, everything you want, dear. Well, everything you want, dear. Well, whatever you want. Oh, I want to run across the street. Okay, whatever you want, dear. Well, I want to run over there and fight that other kid. Okay, dear, whatever you want. You wouldn't do that with a child. You wouldn't do that with any other relationship. Yeah. But we have a tendency with dogs to think that, we have to accommodate them for everything they want to do.
Here's another question from a staff member, and this one is for Master Dog Trainer Gregory. Why don't dog owners pick up after their pets? Did they grow up in a barn? This was a written-in comment to us, and it also says, my neighborhood is filled with dog droppings. I saw one guy let his dog do its thing. I looked at him. He just stared at me like it was his right to spread dog feces in the neighborhood. What's the best approach to confronting an owner about their rules, behavior with their pets?
Boy, I really, really wish I had some kind of formula. But one of the challenges is that we're in such a divided society anyways. And many of us are divided by how empathetic we are and how narcissistic we are. And even that goes into our whole world with how we're dealing with pets and dogs. So the empathetic person their dog's gonna lay out a load on the ground and they're gonna go, oh my God, I don't want anybody to step in that. And that's the empathetic person. They're gonna pick it up because they're part of society. That's how they feel their role. The narcissistic person is gonna go, hey, at least he's not crapping in my house. So, and they're good to walk away from it. So, if you talk to somebody about it, chances are if they're that type of person that's willing to walk away and leave it down on the ground, then they're probably not the type of person that's going to really accept any input that you have to give.
Yeah, I've heard someone say, well, that's just fertilizer.
Yeah.
And I'm like, really? Okay, and then I also, this one's for Dr. Shoddy. This was a follow-up question to this. Is there any danger from a dog or other animal droppings drying up and maybe staying on the ground or staying in that area, wafting in the air?
I don't know if I have a straightforward answer to this one. I'd have to look and see if there are actually studies looking specifically at whether or not dog feces over time becomes more or less benign from the standpoint of animal exposure. The concern with what's in feces is several. Obviously, there's bacteria in the feces. There also could be parasitic diseases, things like worms, for example, that could be in there. And then, of course, if the feces is not from another dog, if it's from wildlife, they have their own set of diseases that you want to be on the lookout for. Plus, eating something that's not really meant to be ingestible will cause dietary indiscretion regardless of what's in it. So whether or not it becomes more dangerous over time, I don't really know. We do know that something like sun exposure to viruses, for example, may be pretty effective at inactivating viruses and killing them. So there is that standpoint from maybe an argument in favor of if it's more dried out, maybe the less dangerous it is. But beyond that, I'd have to look at the literature and see. I'm not sure anyone's doing those types of studies.
Now we have a written-in question from Shirley. It says, I don't have any pets, but I do have kids. It's weird when people let their pets, specifically dogs, lick them on their face. And she's also describing that they lick down below, and she feels like it's really gross. And she's curious, how clean are dogs' mouths?
So anybody who knows me knows I love animals, but also that I can't stand that licking thing. To me, dogs are licking everything, including their own private parts. They're licking the floor, and their mouths are not going to be any cleaner than ours, and arguably probably worse. They don't floss, they don't brush their teeth voluntarily, and they're always licking things. So to me, it's just a no-no. There's also a social acceptance standpoint to this. Just because you might be okay with your dog sharing your ice cream and licking you on the lips doesn't mean that the rest of society is okay with that either. So you have to have some sort of social consideration, despite what you may think is okay hygiene-wise. So take those things into consideration.
Yeah, are there a lot of germs though in a dog's mouth? I feel like saliva is a pretty good cleaner of germs, but I feel like there's
a reason why we have to floss and brush our own teeth, right? We're trying to make our mouth as clean of an environment as possible, knowing you can't sterilize it. Same thing with dogs, but they don't floss, they don't brush, they lick everything in sight. So their mouths are either as clean or probably dirtier than our mouths.
Now I want to go to a call. I have Whitney from Henderson. Whitney, welcome to State of Nevada.
Hi, thanks for having me.
What's your question? What's going on?
Sorry. Yeah, we have a mystery mix dog. We suspect she's either Shepherd or Malinois, something like that. She was a rescue. We got her as a puppy. She's amazing with humans. She's amazing with children. But she, for some reason, does not like small, white, fluffy dogs. I mean, full-on hackles will be up. She'll growl. She gets very annoyed with them. Small, other colored, fluffy dogs she's fine with. It is just very specifically things like Bichon Frise and like other dogs like that. And I'm curious why dogs sometimes just have a type and they don't like them.
Okay, Whitney, that's a great question. Master Dog Trainer Gregory, this is interesting. I'm going to let you take this.
Well, your dog's obviously a racist. No. You got to understand from the dog's point of view, it could be something genetic inside, instinctive, that sees this small, white, fluffy object, and it is reflective of it maybe being a rabbit or some other type of small animal that's indigenous to that area where the genetics come from. The other thing, since you don't know where this dog came from, I tell you, I've come across, running a canine rescue, I've come across a lot of dogs that were actually found out that they were coy dogs. They were part coyote and part shepherd, part Malinois, things like that. And those coyote type of instincts are prone to come out, and you'll see them at the darndest time. So there's a good chance that it's just a genetic that says the dog's prey kill is ignited when it sees this.
For Whitney, should she maybe consider taking the dog to a trainer to train that behavior out? Is that something that can be done, or is it so inherent that maybe it can't go away?
Well, in my opinion, I don't know if it's necessarily the behavior can be trained, and you can teach the dog to, as best possible, ignore the behavior. But does that mean the dog suddenly no longer wants to go after these small white dogs? Not necessarily. And so we have to be careful when we do training like that, that we don't start patting ourselves on the back saying, oh, my dog is cured, he'll never do this again. And then it happens because you dropped your guard. So those are the biggest challenges.
Dr. Shoddy, it is fall, and more people are heading out to Lake Mead. They're heading up to Red Rock to go hiking, and most of us take our pets with us when we go exploring. Can you briefly talk about some of the potential issues pet owners should take into consideration when they're on the trails?
The same environmental concerns you have for yourself, you should have with your pet. So, for example, we live in Nevada. It gets quite hot here, and some dog breeds are more amenable to tolerating heat and some are not. So make sure that you are protecting them from the heat. So, for example, having plenty of water around, maybe using dog-safe suntan lotion, things like that. You also have to worry about the vegetation. We have cacti here. Some cacti are fairly benign. Others can be really annoying and can cause some major issues with your pet if they interact with them. So make sure that you are conscientious of where your dog is exploring during these hikes. We also have wildlife here. Snakes, coyotes, what have you. Same thing. These are potential dangers for your pet. So make sure you're fully aware of these scenarios, know your dog's personality, have things ready on your trail to prevent issues like that. And it's the same way you would take your own precautions, like wearing long pants. If you're in an area where there's heavy tick infestation, protect your dog in the same way. Think about all these factors and be ready for anything that's a potential threat.
You know, I think back to that old fable of the lion and having the thorn in its paw and the mouse needing to pull it out. And I wonder, booties for dogs. Should we be considering putting booties on our pets' feet, especially this time of year when the plants are drying out and those prickly spikies are everywhere?
Yeah, booties are a great option, especially protect from plants like that and also protect from hot ground from the sun. It also is one of those things where too much can cause issues. You can get moist dermatitis and lesions on their paws because they do sweat through their paw pads. And so you don't want to have something that's encasing all that heat and moisture and sweat for too long of a period of time. What is too long? It depends on your pet and how they handle these things. So it would be great if you were to do like trial runs with your dogs in booties, going for regular walks, see how your dog tolerates the booties. Not every dog does. See how long your dog can stay in those booties before causing any issues. Make sure you utilize them to a reasonable extent. They can't stay on your dog forever. That's not reasonable.
And maybe one more question while we're on this fall hiking out in wild. You mentioned wildlife. Master dog trainer Gregory, coyotes. We've had spottings of mountain lions just up in Summerlin, big animals. Can you train your dog or your animal to avoid bigger, larger predators or to stay back or to, come with you instead of doing the growling fit and wanting to engage with them?
That's a question I've never heard before, but that's a really good one. The training aspects, I would say, it's not so much about training, it's understanding your dog. Some dogs are more courageous than others. And some dogs, because of their genetics, are going to see these large predators or see these large animals, and their genetics are going to kick in and say, okay, it's time for me to do combat because we're going into a hunt. And, so if you take a dog like a American Pit Bull Terrier that's been highly bred for the hunting and the game gene, then they could see that creature and go directly at it, and then push right by a little poodle to get to that big creature. And at the same time, the average dog is going to see this predator and realize that I can't take them, and they will typically come back to you, where they're going to feel safe and where you're going to be part of their pack, and the safety comes in staying with your pack. So it's really going to be a lot on their genetics and less about their training.
Yeah, a lot of these questions are actually relate to a very fundamental concept here. Dogs are distant ancestors of wolves, and the reason why we have them as pets is because we've domesticated them. That doesn't mean that every single dog is purely domesticated, trainable, or can even be a pet. And there are many that are wonderful pets right out the gates. So let's not forget, they still have their natural canine instincts. They are still considered animals, and we are doing our best to domesticate them and socialize them to an acceptable level. So a lot of these questions, underlying behavior and Your behavior is based on that fact. Every dog breed has their own personality. Every dog individual has their own personality. They are still considered animals, and so you're trying to navigate these waters.
And I want to jump over to our phone lines now. Deb from Las Vegas, you adopted a new canine. Deb, what's going on?
So I adopted Benny from the Humane Society at PetSmart. They have adoption day on, I don't know, every Saturday or so. So anyway, I adopted Benny, and he apparently, his history is that he was outside for 5 years. What they know is that he's 5 years old. So I tried to approach him, and he books the other way completely. He won't let me interact with him. I mean, a little bit he does. If I give him food or toss it to him, he doesn't know anything. I don't even know if he really knows his name. When he hears his name, Benny, I try to reward him with nice words, and maybe I don't even know if I should be giving him a treat. He books out away from me. He hides under furniture. I mean, he just goes away. However, he's interesting. I live by myself, and I have a giant king-size bed, and I sleep on one side sometimes, and he will sleep on the pillow on the other side. So he's not freaked out all the time. But if I go near him, if there's not food involved, he runs. Like, he'll run away from me. Number one.
Wow.
Number two, frankly, I think he was, somebody must have maybe hurt him. I don't know. He wiggles out of, I can barely take him for a walk. I did pick up a jacket, but it needs to be really, really tight. He's small. He wears a size small.
Gotcha.
And he's,
Deb, this sounds like a lot, and I'm going to toss this over to Master Dog Trainer Gregory. This sounds like a connection issue, or she's trying to create a connection with this new dog, and she needs some guidance.
Sure. Deb, first question, though, I would ask back is, how long have you had this pup?
9 days. Just 9 days.
Okay. Well, I have a young trainer that I work with, and he's got, he's just really fantastic. And he has what he calls a 3, 3, and 3 rule. And it's 3 days, 3 weeks, 3 months. Okay. And basically, you need about 3 days for the dog's personality to start coming out. Okay. 3 weeks is when the bond starts to happen, and he starts to, become part and to show his personality. And then 3 months is when the dog really starts to become part of the pack and working. And it really holds true. You still are at the infancy of that relationship. So just think of it as if it was a person that you were maybe fostering a child or just adopted a child that had been in foster care for the last 5 years. How long would you give in order for that relationship to blossom? If you take your time, it sounds like you're doing a lot of things right. And if the dog is willing to get up into bed with you, then I'm hearing that he's definitely going to become a part of your family soon enough.
And one more note on what Deb asked. She said, is it good for me to be giving the dog treats every time it comes or says the name? Is that a good thing to do?
I would say yes, Deb. But what I would recommend you do, as opposed to treats, which oftentimes tend to be like candy to us, laced with flavor for the purpose of giving the dog, I would say hand feed the dog whatever food you're using, especially if you're using like a kibble. Let the dog eat from your hand. And therefore you're replacing the treats and you're still making that progress, okay?
Deb, thank you so much for that call. I want to jump over to Anne from Henderson. She is fostering multiple cats right now. Anne, go ahead. Welcome to the program.
Hi. I'm fostering 4 kittens and 1 mother cat. And everything seemed to be going along real well. They were starting to use the litter. They were using the litter box. They were just sweet as could be. And I came home last night, and the mother cat had obviously thrown up, and you could see where two of the kittens, or maybe one threw up two different places, and there was tinkles that they haven't done since the first day I had them outside of the boxes. Help. Do I need to take them back to be checked, or is it just, I don't even know what?
I thought we were going to have a feed them after midnight gremlin situation where they kind of changed. Dr. Shoddy, sounds like digestive, some kind of issue. I'm not too sure.
So I'm going to assume, of course, that these kittens are the offspring of this mother cat. I'm assuming that's inherent there, and I'm assuming that you are being able to tell which individuals are actually doing the vomiting and the urinating outside the box, because obviously when you have a multi-cat household, it can be very difficult to know exactly which individual cats are showing which symptoms. So assuming all that is true, you can go one of two ways with this. You can either try to see the veterinarian in person, bring mom and the kittens to the vet and have them perform a physical exam, run some diagnostics, see what's going on with them. Or you could consider more official veterinary advice. Hate to plug my company, vettriage.com, and you can talk to a veterinarian live 24/7 on video to get advice to see whether or not it's worth the stress of taking the mom and the kittens to the veterinarian, or is it something that can be managed at home with some fairly safe advice and monitoring parameters. There are so many things that causes these symptoms in cats that there's no way for us just on this one call, especially without seeing the pets, to determine that. But those are your two fairly broad options. Because the mom does eat all the nutrients she can, especially if she's still nursing these kittens, and because kittens are much more sensitive to disease than adults, you do want to do something fairly quickly. You don't want to let this linger on more than probably the next day.
Yeah, and I hope that answers your question. And it does kind of sound like just monitor that pet for the next 24 hours. And if things keep getting worse, to consult with your veterinarian. I do have a written question, and this is from Sherry in Henderson. She says, Halloween is coming up, and that means a lot of candy around her house. She's concerned about what she should do if maybe she finds out her pet has consumed a lot of chocolate or candy by accident. She has kids. What should be the first thing that she considers?
So veterinary consultation is always going to be the first step with these types of scenarios. You want to try and avoid things like Google, because although searching for information on the internet can be useful, it often results in confusion and more fear than maybe is necessary. It also depends on what kind of candies you're talking about, how much candy, what does your pet weigh, what's your pet's breed, medical history, your own pet's biology is going to dictate how they react or not to that ingestion. So you want to consult with a veterinarian, whether it's virtual or in person, and get some advice from there. Or some pet owners will skip right over to the Pet Poison Helpline, which is a great organization that talks about toxicities. You can consult with their veterinarians, toxicologists over the phone as well, and get their advice. Also, obviously, the whole premise here is avoid the interaction between your pet and candy. But if it does occur, then you've got several avenues that you can entertain.
And that's Dr. Shadia Rafich. He's the Chief Medical Officer with vettriage.com. We're also here with Master Dog Trainer Gregory. This is a question from an anonymous person who writes into us. They say, Thanksgiving is around the corner, which means more gatherings with loved ones. I get a bit of anxiety when I see pets and it's time to eat. It's because on more than one occasion, I'll hear choking sounds from under the table. One year, my uncle's dog was choking on a chicken bone and no one knew what to do. So my question is, when an animal is choking, what's the best way to help without potentially harming yourself?
So first thing is, we're talking a lot about dog training here, but it sounds like questions like these need some human training. So that's number one, make sure you can dog-proof the house, let's say. Number two, actual choking in dogs, because we get this question a lot. Actual choking is incredibly uncommon. Choking as defined as there is a blockage in the gastrointestinal tract, specifically the esophagus, so the throat area, where there's literally no fluids from the stomach can leave and nothing can enter because there's a complete blockage. Those are incredibly rare. And if those do occur, usually you'll see a pet who just becomes rapidly and progressively more and more sick, literally every minute. Those are very, very serious. Most pets, when they are described as having choking, it's more of an irritation because they ate something they shouldn't have eaten. Maybe it's the components of that food they ate, or maybe it's something that went down the throat the wrong way, like a bone with sharp edges. And those are not medical emergencies per se, but the same answer is going to apply here, where you just talk to a veterinarian to decipher whether or not it truly is actual choking or whether there's just an irritation that we can manage a little bit more easily at home.
And I have a similar question to that, because I'll often see, having had bigger dogs, they get into something or they're eating something they're not supposed to, and the first thing you want to do is reach in their mouth and pull it out. Is that the best thing to do? Is it? I mean, your dog. We've been mentioning this through our entire conversation, is your dog's behavior, but is it safe?
If you can see that the foreign object you're trying to remove is in the oral cavity, in their mouth, usually either stuck at the roof of their mouth or stuck underneath their tongue, kind of lodged between the arcades of the teeth, and your pet seems to be amenable to that, then you can try. We don't want anybody getting hurt. Even that is not a life-threatening condition for your dog. So you don't want to risk your own safety just to solve a problem that could be managed easier and safer at the vet. However, don't forget, most dog breeds have really long snouts, and they also have really sharp teeth. So putting your hand in there blindly while your pet may also be in distress may result in trauma to you and unsuccessful completion of your initial goal.
Thank you, Dr. Shoddy. I have a phone question, and this is from Dina in North Las Vegas, who has a 7-month Jack Russell. Dina, welcome to State of Nevada. What's your question?
Thank you. My question is, I have a Jack Russell puppy, and we took him to PetSmart to go through the basic puppy training. He actually went through it twice, and it absolutely was a waste of money, because he basically, after the 6 weeks training, he basically learned nothing other than maybe sit. I think maybe that's what we got for our money. So our vet has suggested putting him on medication because he's got a lot of energy. He's 7 months old, and I was truly against that, so much so that I'm looking for another vet. And I wanted to get your take on A, PetSmart training, and B, medicating a puppy.
Let's start with the medicating process first, and then we'll go to PetSmart training. Dr. Shoddy?
So Jack Russells, of course, are known to be balls of energy. That's number one. Number two, you're right. This is a puppy. They're going to be balls of energy anyway. And we as veterinarians tend to want to fix problems right then and there. And most training issues can't be fixed right then and there. It takes time and commitment and energy. And so the quick fix to this would be medications, sure. I'm not sure I'm a fan of that plan either. I think I would go the route of, this is a Jack Russell known to be a high energy breed. This is still a puppy. You've got several more months before they become an adult, and training might be more of your investment for this issue. Or maybe it's not an issue at all, and you just need to weigh it out. I'll defer to the master, but that's how I would see it as far as the medication standpoint.
Yes. What are your thoughts, Master Dog Trainer Gregory?
On the aspect of the medication?
Medication, and then on the PetSmart training.
Well, I can't speak from the form of a medication, really. That's not my expertise, and I would sure hate to act like it is. But I can tell you that if you're trying to understand the Jack Russell, you really have to understand the original breeding. These dogs were bred to be hunting dogs, high-energy hunting dogs, and to take on things that were oftentimes a lot stronger than they are, a lot bigger than they are. So their energy level is sky high, and that's just part of the breed that you're going to have to learn to live with. Things you can do, exercise them. Find a way to exercise them. A lot of them love to chase and chase balls, things like that. Keep them exercised, keep them tired. As far as the training for the pet superstores, I don't think it's fair to single out a particular store, so I'll just say the pet superstores. They're a corporation, and they're always going to be more concerned about their bottom line, and they don't want to ever do anything that's going to make it seem as if they're being cruel or unusual in any way in how they're dealing with dogs. So the techniques that they're using are oftentimes used for dogs that are not bred with the same type of genetics that maybe a Belgian Malinois, Jack Russell Terrier, a Pit Bull Terrier, Dobermans. They oftentimes don't have the skills, wherewithal, or the background, or even the go-ahead from the company to do techniques that would oftentimes be able to help train a dog like that we would use in maybe working with police dogs or heavy drive hunting dogs.
Well, I hope that answers your question, Dina. Thank you so much for giving us that call. I want to jump over to Stephanie from Las Vegas, who has a question about dogs in the back of pickup trucks. Stephanie, go ahead.
Hi. Yeah. Now that the weather is getting nice again, people are taking their dogs with them more places. And I see pretty consistently, I'll see somebody who has a dog in the back of a pickup truck in the bed, loose, not in a crate or anything. My understanding was that's illegal in Nevada. But I was wondering if you could speak to, even if it's not illegal, the safety issues. That seems to me like that would be a huge safety concern for the dog and other drivers.
Yeah, Dr. Shoddy?
Again, this falls underneath the category of human common sense, human training. Nobody's going to advocate for a dog being in this situation, whether it's legal or not. I actually don't know if it's illegal here or not, but to me, it's a common sense issue. We do see plenty of dogs that fall out of cars or jump out of trucks when and severely injure themselves, not only sustain trauma like breaking their leg, but also now they're on a road where there's other cars driving by. And of course, like you mentioned, other drivers. Yeah, that's a huge distraction and a danger for other drivers. So it's a big no-no to me. There are plenty of ways to prevent these issues from happening, and nothing frustrates me more than having issues with pets that were preventable. So that's my thought on that.
Stephanie, thank you so much for that call. Christine from Las Vegas, what is your comment and your question?
Hi, thanks for taking my call. I have a Min Pin. He's 14 years old, very, very active, healthy, and just a ball of fun. He has one issue, and that is he will pee after visiting my son's house or a friend's house. He'll be fine, and then the next thing I know, he's peeing on a shoe or in the closet. Can you tell me what is going on, and is there any way I can prevent him from doing this?
So I'm going to assume that you've had this dog for the majority of his life, number one. If this is a new dog to you, then certainly behavioral issues may come into play. However, for a 14-year-old dog that you've known his entire life to all of a sudden now have behavioral issues may not be on the top of my list. I'm thinking more of a medical issue here. And in terms of medical characterization in your particular case, I would divide it into two different categories. Either it's something related to the urinary system itself, so kidneys, ureters, urinary bladder, urethra, and prostate, or related to neurologic function or dysfunction rather. And we have to differentiate between those two things if we're going to agree it's not a behavioral problem. So if we think it's a medical problem, you have to go to the veterinarian for this type of issue. It's not a medical emergency, of course, but you need testing done to figure out exactly where in the body is the problem, and then what can be done to help support the help support your pet through this. It's a 14-year-old dog. There's a long list of potential medical conditions in both categories that can affect and result in this type of behavior.
Christine, I hope that answers your question. Thank you so much for giving us that call. Lloyd from North Las Vegas, you're on the air. What's going on?
Hello, thank you so much. So my question is, I have a dog. He's 3 years. He's going to be 3 years old this month. He's an Irish Wolfhound and Standard Poodle mix, and I have not fixed him yet. I haven't fixed him because mostly his temperament's okay. I didn't think that I needed to. I'm just kind of nervous where, like, the pros and cons. I don't want him to get cancer or anything, or more prone to cancer. So figure I'd ask you guys.
There are medical conditions in male dogs that will decrease in prevalence in neutered dogs, and there are others that increase in prevalence in neutered dogs. The vast majority of medical conditions are prevented in dogs that are neutered. And so if you look at both sides of the story here, health-wise, we always advocate for neutering for medical reasons, but also let's say your dog escapes one day and now impregnates an intact female, you've got another problem on your hands now. So there's also a social behavioral aspect to this as well if he happens to mount a female who's also intact. So my recommendation would be for neutering. There are plenty of male dogs out there that live their lives intact, never have issues, and there are some where we see them in the clinic, they're so sick because of a disease related to them being intact that it would have been easily solved had they had neutered them years ago.
Lloyd, thank you so much for that call. I have a comment from an earlier question about picking up after your dogs from Deb. And Deb says, people that don't pick up after their dogs, I ask them, do you need a bag? And she says, if I don't get an answer, I pick it up right in front of them.
Wonderful, Deb. I like that.
Thank you, Deb. I like you, Deb.
I'm going to use that one myself.
Okay, we have a question from Tyler in Green Valley, and he writes, how are pets doing adjusting back to normal life post-pandemic? I didn't work for 2 years and was always home. Now I'm back to 40-hour work weeks, and I worry about my 2 dogs. And it also has this follow-up of, I think he wants to know if dogs get depression, and if they do, is it something that can be trained out of them, medicated, or is there a better option?
So I tend to stay away from words that describe human emotion. So depression, for example, I'm not sure we really recognize that an actual clinical condition in dogs. We're personifying it too much. However, separation anxiety is a true condition. And I was hearing a lot more about this problem towards the end of the pandemic as things were opening up more, much more than I've heard recently. So I have not seen it be as big of an issue. Obviously, if you're seeing that type of behavior in your own pet, where now that you're becoming more and more separated from them, from the home environment, and now your dog is acting out, then training and or medications are going to be in order.
And I am just curious, if your dog does have that separation anxiety or starts to pull away, is getting really sad, is that a trainable behavior? I'm not sure. That's just like, can you train someone not to be sad?
Well, separation anxiety can come from so many different reasons, but one of the challenges that happened when COVID hit and the whole pandemic is that people were at home with their dogs, isolated. So it's just you and your dog and you and your dog and you, and that relationship, especially if you had it with a puppy that you just got. So that puppy spends its first year and a half, 2 years being bonded to you, and nobody but you. It's not exposed to the rest of the world because you're keeping it in the house, you're keeping yourself in the house, and now you got to go back to work, and everything that dog knows is you. The only social aspect of this life has been you, and so that can be a challenge. The best thing that I could suggest at that point is that you start getting the dog out and letting it learn that the rest of the world does exist, and that not everything in the rest of the world is going to hurt them. In fact, if they can learn their social skills, they can get out and become part of it, and it'll take off some of that dependency on you as that one person that fulfills all of their social needs.
We have a few more questions and only a few more minutes, so I'm going to start to go through these. Alice writes us, I have a betta fish at home that has a huge tumor-like ball on its side. This happened to my last betta. I took it into the vet, and they kind of chuckled at me for bringing him in. The vet gave me a solution to put in the tank. He died 3 days later. Any advice or knowledge on what might be wrong and how to save my fish?
There are a small handful of veterinarians in the United States that will specialize and even perform surgery with anesthesia on fish. So it's not an unheard of aspect to it. On Vet Triage, for example, we've seen 30 different animals, squirrels, fish, horses, you name it. So veterinarians are licensed to handle any species. However, of course, the majority of us specialize in a certain number of species. So if you have a fish and you're willing to invest the travel and the finances to get them checked out, you can find a fish veterinarian. It's going to require some traveling. I know Cornell University, for example, they're fantastic in this realm, but you have to find a veterinarian who's comfortable with fish, who knows how to advise you appropriately and institute treatment from there.
I have a question from Stan, and he has a 6-year-old husky, and he says that his husky is very, very quiet. Like he wants to bark and wants to say something, but he won't, and makes very little to no noise. Is that unusual? I feel like when I see huskies, they're very vocal. Do you think something's wrong?
So every dog breed has their own personality, as we've mentioned already, and every individual dog has their own personality. I would venture to say that most people would like that their dog was quiet and not howling. And yeah, Huskies, Malamutes, these dogs are very vocal. They're very OCD to some degree. And so I don't view it as an actual pathologic problem. However, having said that, the neurologic control over vocalization is a complex one that you could sort out with a veterinarian, especially if you get to the point where the more basic diseases are ruled out and now you're looking at consulting with a neurologist, a veterinary neurologist, to figure that out and see, is this just a behavioral quirk of your dog or is this actual pathology that you want to tackle early?
We have about a minute left. Question from Lorraine in Summerlin. She has a Lhasa Apso and Shih Tzu. They are very picky eaters. She cooks for her dogs a couple times a week, plain chicken breasts, rice, veggies. She wants her dogs to also eat dry food. And she says, I've heard if they are hungry enough and the dry food is left out, they will eat it. Will that work?
So plenty of pet parents these days are trying to find foods that are more natural and less kibble-like. Whatever diet you want, if you have the time and energy and skill to cook for your pet, have at it, as long as it's considered a maintenance diet. There's an organization called AAFCO, AAFCO. They determine kind of what the basic bare minimum requirements of protein and fats and what have you for your dogs. So, but if you're going to let them choose between kibble or some yummy chicken, they're going to choose the tastier of the two. So if you're looking to go exclusively to kibble, then you can either try to mix the two together, hoping your dog will eat both, or you may have to cut out the home-cooked diet completely, put that dog food down every day, refresh with new kibble, and by day 2, 3, 4, 5, if your dog is not eating, they should be hungry enough at some point to eventually eat.
And joining us today, we had Dr. Shadia Rafij. He is the Chief Medical Officer at vettriage.com. We also had Master Dog Trainer Gregory, and I want to thank them both. And I want to thank you for everyone who called and wrote into the show today. We really appreciated it.
Polls, way ahead in the polls. And if he does not win in the first round, that means there was fraud because the electronic voting machines don't work.
The question is, if Bolsonaro continues to follow Trump's playbook, are the tech platforms and Brazil's institutions prepared for the results? Shannon Bond, NPR News.
And we should note that WhatsApp parent Meta pays NPR to license NPR content.
This is NPR News.
Scientists didn't want to work on NASA's Pathfinder mission to Mars 25 years ago. It had a shoestring budget, skeletal team. Scientists doubted the rover would even work.
You found whatever the problem was and you got the right people and you solved it as good as you could in the time that you had.
How an unlikely robotic vehicle paved the future of space exploration. Tomorrow on Morning Edition from NPR News.
Join us tomorrow morning from 5 to 9. Nevada Public Radio and Desert Companion magazine celebrated the 10th anniversary of the Focus on Nevada photo contest earlier this summer. You can catch the photo showcase on tour with the winning photos at the latest stop inside the hub at B&C Canberra. That's during normal business hours through October 7th.